Hello everyone, my name is Rukoya Abdulrazak and you are welcome to my presentation. So today I'll be discussing about the policy issue of long wait times and Indigenous healthcare inequities in Canada. This issue is not simply about scheduling delays, it is about a systemic pattern that places Indigenous people's life at greater risk for poor health outcomes. So the long wait times deepen already existing inequalities and cause preventable illness to get more worsened. And the chronic disease are left unmanaged, and conditions such as neurotrauma and dementia progresses unnecessarily within the communities of Indigenous people. And one striking and heartbreaking example of this systemic failure is the death of Brian Sinclair in 2008, a First Nation man who died after waiting for 34 good hours in Winnipeg emergency room without receiving the proper health care that he truly deserves. So his death highlights what happens when a health system fails to prioritize Indigenous lives. So this presentation today will explore why these inequalities exist and what policy changes are urgently needed. So now to my next slide, why this matters for Indigenous health. So Indigenous peoples experience disproportionately high rates of infectious diseases and chronic conditions, and long wait times worsen these disparities. Tuberculosis is one of the clearest examples, as TB remains persistent and deadly in some Indigenous communities, largely because of chronic delays in diagnosis and treatment. Systemic and interpersonal racism also plays a major role. Like Matthew noted in his article, it describes how cultural insensitivity within healthcare institutions discourages Indigenous people from seeking timely care. So geography is another barrier. So many Indigenous communities are far from hospitals or specialists, which increases travel time and delay the care. Sometimes when there is disease or when there is something wrong with the body, to get a proper diagnosis earlier also help with the treatment. But imagine when someone is affected by a particular disease or stuff like that, and there's no nearby healthcare facilities. So returning to Brian Sinclair case, the assumption and stereotypes made about him, believing he was intoxicated or maybe he was sleeping it off. This shows how racism directly prolongs wait times and leads to preventable death. His story demonstrates why this issue is not theoretical but a matter of life and death. So to my next slide, the evidence from neurotrauma and dementia research. This research on neurotrauma and dementia further highlights inequalities among the Indigenous people. Indigenous patients who experience neurotrauma often receive poorer quality follow-up care and face long delays compared to non-Indigenous patients, as shown as by Salain and colleague. Similarly, Webb Kamig we feel that dementia health literacy is low in many Indigenous communities because culturally appropriate services are lacking among their communities. So this gap are made worse by limited resources and by delays caused by long wait lists for the specialists. When we think about the Brian Sinclair case, we see how the system fails not only in emergency but also in chronic and long-term conditions where timely assessment and continuity of care are essential. So his death reflects systemic issue that also shows up in neurotrauma and dementia services. So to my next slide, what is the core policy question? So the core policy question, I can say, why do Canadian health policies fail to provide timely, equitable, and culturally safe care to Indigenous people? This question is important because the failure are not accidental. No, they are not accidental. This shows how rooted in the design of the healthcare system itself, including funding, structures, governance models, and institutional attitude. Yeah, and moving to the next slide, identifying the key policies gap. So several major policy gaps explain how wait times become deadly for Indigenous people. Yeah, and the first most is the Canada system relies almost entirely on Western biomedical models. They do not believe on indigenous medications like the ceremony, the ceremonial, those stuff like the indigenous, the use of indigenous herbs, the roots. Like the healthcare system does not believe in that. They only believe in the Western models of health. So this model overshadow our indigenous healing tradition and dismiss culturally grounded practices. As Matthews emphasized in his article, he explained that this erasure leads to mistrust and peer engagement. And secondly, chronic underfunding affects many indigenous communities. Without proper diagnostic equipment such as maybe X-ray, CT scans, MRI machines, even straightforward medical assessment become delayed sometimes for months. Yeah, sometimes for months. Imagine having a disease and going to the hospital and just to do some MRI, X-ray, and they'll be like there's no doctor available, or you have to wait for like the next 8 months before you can get a scan. That is really bad. And thirdly, indigenous people have limited authority over health planning. Yeah, so most health decisions are made at the provincial or federal level, with minimal indigenous leadership included. So this results in policy that do not reflect community need. And another impact is that there's a severe underrepresentation of indigenous healthcare workers. Yeah, so this impacts culturally safety and trust for indigenous people in the healthcare system. So the two factors that could have changed the outcome in the case of Brian Sinclair, so who might have received attention sooner if culturally competent care had been presented to him. So together, this gap reinforce systemic inequalities and make long wait times an expected part of indigenous healthcare experiences. And moving to the next slide, which is about policy options. So there are several policy options to address these inequalities among the indigenous people. So this model will allow indigenous communities to make decisions about their own health services. For the pools, it increases cultural safety, it aligns care with community values and builds trust among this set of people. And the cons for it is it requires structural reform and may face political resistance. And for the second option, which is expand of indigenous healthcare workforce. Yeah, so recruiting and training more indigenous health professionals can improve cultural competency and reduce barriers among the indigenous community. And better communication, stronger trust, and more continuous care among them. And training pipeline take time and require long-time funding. And another option here is invest in community-based diagnostic capacity. So providing local diagnostic services such as for the tuberculosis, neurotrauma follow-up, or dementia screening will dramatically reduce wait times. Yeah. So if there is earlier diagnostic, this will also help to prevent all these long time diseases if it is detected earlier enough. So the treatment will be easy and it will be faster. So, and this will provide like faster diagnosis, fewer referrals, care closer to home. These options help address the systemic failures illustrated by the death of Brian Sinclair. So, which case reflect the need for culturally grounded, community-led, and timely health care. Like seriously, everyone deserves a proper health care. And for my final recommendation here, the most effective solution is a combination of strategies. So which is the indigenous-led healthcare governance. So I will implore our government to allow the indigenous-led healthcare governance. So which will be supported by the community-based diagnostic services and strengthened by an expanded indigenous health workforce. This approach will restore self-determination, improve cultural safety, reduces wait time, and strengthen long-term health outcomes within the indigenous people. Reform that could prevent tragedies like the Brian Sinclair case. So we pray not to have more of that in our society, because it's really a tragic story to learn about the Brian Sinclair case. In a situation whereby systemic bias and inadequate trial procedure resulted in further neglect. And in conclusion, improving indigenous healthcare require deep structural change. Yeah. So long wait times are not just operational delay, they are the result of the colonial policies that deprioritize indigenous well-being. The evidence shows that indigenous people experience the consequences across multiple areas, not like multiple areas, therefore like tuberculosis, like neurotrauma, dementia, and chronic illness. The death of Brian Sinclair, I keep emphasizing on the death of Brian Sinclair because I can't forget it since I knew about his story. It's really a tragic one, and it has, like, I can't even take it off my head. So like the death of Brian Sinclair now is a powerful reminder that these inequalities are not abstract, they are immediate and deadly. Yeah, they are. So a more equitable system must include indigenous-led governance, community-based diagnostic and treatment services, a stronger indigenous healthcare workforce, and the indigenous design evaluation framework. So only by making these changes can Canada ensure that indigenous people receive timely, culturally safe, and effective care and prevent future systemic failures like the one that ended Brian Sinclair's life. Who knows, maybe he may still be alive till now if he actually received the proper care he needed at that time. And for my references, I have included all the references here. Yeah, I've included the references. Thank you so much for listening to my presentation. I really appreciate it. Thank you so much, and bye.